Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Monday, January 11th, 2021. It is time for our afternoon COVID update. As we talked a few weeks ago, with the increase of number of cases and acuity since the Thanksgiving holidays, we wanted to do these updates on a consistent basis, a nice drumbeat. So every Monday, Wednesday, and Friday, we'll be just giving updates of where we are. Not much change since Friday when I talked to you about how critical and severe we were. But over the last few days, we've been maintaining and down a few cases over the last few days in patients. As of a few minutes ago, we have 15 COVID patients in the hospital. 4 of those are ICU, and so 19 total COVID patients, down from 23 last week. So a little bit of a dip over the weekend, so we were great to see that. But from a hospital perspective, we have increased in non-COVID cases, with our ICU being full and waiting on several patients in the ER at this time for ICU non-COVID beds. So even though COVID dipped a little bit over the weekend, we increased in other areas of the hospital in healthcare as well. So we're about the same place we were on Friday. So we're at that point where it is severe. Now, like we talked about Friday, and we'll continue to talk about every time we do this update, we are open. Use 911, use our emergency room, but please do not come to the hospital or any hospital in the Northeast Texas region if you need help. When we look at the numbers and we talk about it, as you can see, and we'll go big screen on this one so you can look at our 7-day of our occupancy rate. And this is COVID as a percentage of hospital beds in our region. Yesterday it was 20.89. So on the January 9th, you can see that dip a little bit from the high on 22.54. So a quarter of the patients almost of people in the hospital in this region were COVID patients. That's high. For us, though, we've seen more than 1/3 of our patients be COVID patients for the last 5 to 7 days. So we understand what the rest of the region is going for, and we're seeing that as well in this area. I like looking at this on a daily basis, and we keep track of this. But this is the number of ICU beds with COVID, ICU beds, and then COVID beds that are being used. And you can see we hit 240 on the 8th, which is Friday. And you're going to see that in a couple slides I'm going to show is pretty much the region. That's the peak that we've seen with 240 COVID patients in our region. Dipped a little bit on Saturday and a little bit yesterday. We'll be watching that the next few days, I hope, and hope a lot. And we pray that that number will continue to go down, and maybe that was the peak on January the 8th that we've seen. You can see the ICU rooms of 75. The availability is at 6 and 4 the last few days. So we're still variable, almost limited ICU availability in the region still, but we're staying about where we were for the last few days. I like to also look at the Tyler and Dallas area, what's around us, so we know what the effects of COVID in the other regions that affect us, whether it be transfers or our friends and relatives in those areas as well. You see the same thing. It was interesting. You'll see in the Dallas and in the Tyler one that middle of last week, they hit their peak at 684 cases in the Tyler region in the hospital, down to 589 by yesterday. ICU was down 157, 158, down to 145 yesterday. And we go look at Dallas, you'll see that same region, about 4172 on the 7th. They've gone down since then. Their ICU beds have stayed relatively the same in the Dallas region, but you can see their hospital COVID patients hit that peak about 4172. So it'll be interesting to follow over the next few days. Did we hit that peak 7, 8 days after New Year's Eve and after Christmas? Would like to hope so, but we don't know. So the one thing I'm going to continue to encourage you to let you know is it is severe. I talked to a doctor this morning. We both were talking about it. He shared with his family and some of his colleagues as well over the last couple of days that there is something different about the COVID cases since Thanksgiving. Is it a strain you hear about? Is it just because of the time of the year, maybe stress of Christmas and the time of the year and stress of friends and family being sick? Maybe it's the flu season. It was all a little more susceptible to colds and flu. I know my family has seen a lot more of the head colds and those types of things over the last few weeks. You put all those together, does that mean more severe cases of COVID? Because when people are coming into the ER, they seem sicker. And unfortunately, it's very sad, but we've lost some friends over the last few days. And I know a lot of the people, when I look to my left and look at the people watching it, Regina, I see Connie Hernandez, Miss Edwards, we all know some of the same people, and we've all watched. We look at Facebook and see some of the comments of people we've lost over the last few days that are friends of ours and family members of some of yours. They've lost to COVID, or maybe the remnants weeks later from COVID that started their decline. But it has hit locally, it has hit home. for all of us. So I would encourage you to the best of your ability. If you have any of those symptoms, please stay home. Please isolate yourself, and please, more importantly, get to your doc. My mom called me a few minutes ago and wasn't feeling good and working hard to get her to go see a doctor immediately. You just can't wait. And that's what I told a friend of mine yesterday. And we have a friend of ours that's in the Arkansas area that's in ICU that's my age. And, we're watching him. And the one thing I keep telling people as we're talking, don't wait. Do not wait. If you get any symptoms or signs, please see your PCP, your family care doctor, and go to the ER if you need to. Just don't wait. So I also want to give an update on vaccines. It's been the topic that we consistently talk about throughout everything that I see. Well, anywhere I go, everybody's wanting to know about the vaccine and when I'm getting our shot and what's the next and latest. Well, we are going to be able to get, from a Titus regional perspective, the week 5 shipment. We were notified early this morning that we'll receive 300 more doses of what I like to refer to as first dose. Everybody receives a first dose. We'll receive a second shot as well. So we'll be receiving shipments along the way that are designated for first dose and also then for second dose. For many of the healthcare workers and first responders and some of the high-risk people who are able to receive the first dose shipments of week 2, their second dose will be coming shortly, and we'll be able to get their complete vaccination done. But we are received just a few. I was hoping for 1,000, and really after some of the things we'd asked for and done, we were hoping we'd get a lot more in this dosage, but we're going to get 300. We have almost a couple hundred healthcare workers in this region who have not gotten their shots yet, so we'll be working with them and some high-risk people as well, and some of our teachers as well, the different groups that fall into the state's 1B. We are following the state's guidelines. I would like to put out, if you'll get to your friends and family that are out there, we are keeping a waiting list, and we are pulling from that, and we'll stratify from that. But if you go to the Titus Regional website, we've kept it real easy. But right there at the top, there's the COVID-19 vaccine waiting list. Click on that and put your name in there. So I ask you some questions. I ask everybody to be patient. We are going to have to stratify by the state's requirements and give to 1B and certain things first. And we're using that waiting list as our ability. Now, we have been told by the state, we're excited to hear that we're hoping with week 6 and week 7 and week 8 shipments, the states will be able to send more. After week 4, the state did finish all their first dose and second dose shipments to all the nursing homes in the state of Texas. I really didn't think about that until I read it on Friday night, early Saturday morning. But when you think about it, of vaccinating all the nursing home patients throughout Texas, that took a lot of the shots and vaccinations that were allocated to Texas. So with that done, Texas is going to have some more to send out. So we're hopeful, and we are working with the state and local authorities as well to maybe provide a vaccine opportunity in this region. Titus has asked for 2,500 a week, which would be 500 vaccinations a day, which is a lot. But if the state will make that commitment, Titus and our board of managers and our administration team have been committed to putting the resources in place to stand something up to serve this community. Also, when we talk vaccines, there's also a lot of people have concerns about the vaccines and questions. We are excited to announce that on Thursday night, January 14th, this week, at 5:30 to 6:30, we'll do a Facebook Live. And Dr. Craig DeLisi and Dr. Gerald Stagg are both going to take questions. So please join us from 5:30 to 6:30. I'm excited about that. I'll have the opportunity to moderate those two individuals. And first of all, they're great guys. They're great men. And then second of all, they're great doctors. So it's a good opportunity for you to have the face-to-face virtually and get your questions asked and the ability for us to seek guidance. And if you have questions about vaccine, it's your chance to ask those two gentlemen. Again, I ask for your continued prayers. Prayers for our health system, prayers for healthcare workers, prayers for our patients with COVID and non-COVID that are in our hospital and other hospitals that are from this region. I had to go to other hospitals as well. But I ask you to continue to pray. Thank you for your support of this health system and this community. God bless.